Good job, Kiki.
Here is we are going to show you guys. I'm a big fan of XCPs, posterior, anterior, and bite. You guys might do it different. If you're working in an office, there's all different kinds of different ways to take an x-ray. I just feel like learning purposes and how I've done it forever, this is the easiest way, okay? So, Miss McKay is going to go ahead and show us how to do an upper right x-ray. So we're going to go ahead and get our XCP now. There we go. Digital films, we're just going to place them in the mouth today. They have barriers on them. Upper right. So in dentistry, her right side of her face and her face, we're going to cross. So we know it's got to be this side of the face. We're going to aim for areas 2, 3. Now the posterior yellow is a little bit tricky sometimes. I have to match it up. Okay. We know that the black part of the barrier is going to face you, the assistant. Good job. And we know it's correct when we look through the circle and we can see the bite block of the film clearly through that circle. It's got to be. Because when we put the x-ray machine, the tube head, and the position indicating the device, the PID, up to the circle, wherever we put it up, that's where the radiation is going to go, and that's where it takes x-ray. So if this was upside down, it's not going to work. We get called a cone cut. Okay? She's going to follow that occlusal line. Okay. And that's how she's going to line up her x-ray. She have the patient bite. She pushes that down and that PID off the x-ray tube head comes right. Yeah. Very good job. Okay, I'll let her go ahead and take that out. Very good. Alright, now she's going to show you the anterior. Posterior films are horizontal. Anterior is going to go vertical, up and down. She's going to line it up with the incisal edge, 8 and 9. Very good. Circle. We tell patients to close their eyes. It's just a scary thing when this whole machine is coming down you like that. So they close their eyes and this circle helps guide us. Okay, you can take that out. Very, very good. And then last but not least, I'm going to show you guys the bite thing. Kind of one of the easier ones to do. But we always have to follow that line, whether it's incisal or occlusal. If you don't, if it's not parallel to the teeth, then you'll have overlapping on the film. So this would work for the left or the right side of the mouth. It's kind of like an universal thing. Simply shoot this bite down. Very, very easy x-ray to take. Very good job. Very, very good. Okay, who would like to... Our students do take a class called radiology. You notice that we all have our badges, like I said earlier. We take the radiographs on a mannequin made just for that. We do not take x-rays from each other. They are digital. And then at the end of the 6 weeks of the class, we send those badges off to measure to make sure that these students, these kids stay safe the entire time. Knock wood. Zero radiation hits my kids because everybody's got to leave the room. Before they finish the program, they will have taken a full mouth series, usually 15 to 18 x-rays. What Miss Gordon's doing right now is she's got a compromised matrix retainer held together by screws and knobs. They're tricky sometimes. I want all my students to be able to do this before they graduate the program. feel that it's important to talk about amalgam. We talk about amalgam versus composite restoration in chair side 1 and 2, and I just wanted to know that there's importance in both, and there's reasons why we would want to do both. Power wash that for me and dry. We're very gentle, very good at it. Now, I still feel some soft decay, so what's going to be the next instrument I want? Very good. Come all the way down to the spoon. Very good. Alright. I want to pour it one more time just to double check this. If it's sweet, it's clean. If it's soft, you got to go back after that decay. Alright. Come back over here. Alright. So we're going to mix amalgam. All the other little metal skin and things. I can't even remember all of them. But anyway, it separates it. Once it comes together, we have a mouth. It's an alloy, silver filling. Oh, that's okay. If the capsule is not in this little grabber, it'll sound like a pinball machine. So it won't mix. I'm going to load this into the amalgam carrier. There's a small and large end on that. It's going to give me my working end down because we're working on the bottom too. Very good. Comes all the way down. You see that? Now, we know that when we get the carrier out, what's the next instrument going to keep that condenser, that plugger in her hand, and she knows I can't push into the tube without it. This is all the amalgam we're going to need. Very good. She knows that she's going to go ahead and get a burnisher out and her suction. This is a little tricky, I'm not going to lie. Because the suction's needed because these little scraps will start going everywhere. So she's going to hold it about right here. Stay right here, Ash. Nice do this and slip this into the suction. Good job. Ashley is already going to anticipate my next burnisher. She's already got it in her hand. So as soon as I give her the signal, she's going to go ahead and come over like this. I have my football burnisher in my hand. That's perfect. I didn't even have to tell her. Next I'm going to need my carver. Good job. This point, cleanoid, getting off the excess without a clean. We know we don't need our hauling back because why there? No interproxia. I'm just doing the occlusion. Okay? Good. So she knows the next burnisher, my favorite burnisher is the raw burnisher. I'm going to just make this nice and shiny. Hand that to her. Just going to do a little power wash, make sure there's no scrap anywhere in there. And dry, dry, dry. And make sure no scrap. Come over and suction. See any scrap anywhere, Ashley? I do not. Perfect. Dry that one more time for me. Just direct air on that food. Perfect. Now, there's no interproximal. I'm not going to use floss, but I do want articulating paper because I need to check the bite. Now, I'm going to let Ashley put this in here. There is an articulating holder, but you can do it just like this too, so it will hurt anything. Just watch your little fingers there, Ashley. You're going to hold it. Like this. Okay? That way he's not going to bite me, but I still have it. Okay? Chomp, 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 chomp. Good job. And you have your suction out wide. So we want to get the debris. Yes. Want debris and you get the scrap out. I'm going to check with the articulating paper again. Just to make sure that the occlusion is good. And dry. If you'd like to know more about our program, or if you'd like to even come here and watch and be a part of the dental assisting program, please reach out to admissions. My name is Miss Renee, and I thank you.